Hi, so we will be getting denials for Medicare insurance for 59 modifier. Okay, so we will be replacing this 59 modifier with X modifiers. So there are four modifiers. The first one is XE modifier, which says separate encounters. So the procedure is distinct because the service was performed in a two encounters or separate encounters. So this is XE modifier. And the next modifier is XP modifier, which says different practitioner. So the service is distinct because it was performed by different practitioner. For example, in the morning, a patient is coming, she or he is taking consultation, and again in the afternoon, patient is coming back for the particular specialty doctor. Okay, if she is a pregnant, she will be visiting for gynecologist. Okay, that's where we will be using XP modifier. Next modifier is XS modifier, which says separate structure or organ. So the procedure is distinct because it was performed on separate structure or separate organ. Okay, this is where we will be giving XS modifier. And one more modifier is XU modifier, which says unusual non-overlapping services. So these are the four Medicare modifiers where we are replacing with the 59 modifiers.